My name is Alia Edina binti Cik Muhammad Nuruddin from the Nutrition Program. Today, we will be discussing the lymphatic system. What is lymphatic system? The lymphatic system is a network of conduits made up of lymphatic tissues and lymphatic vessels that carry a clear fluid known as lymph. This system plays a vital role in maintaining fluid balance in the body, absorbing and transporting fats, transporting immune cells, and supplying nutrients. The lymphatic system consists of lymphatic tissues and lymphatic vessels. The major lymphatic organs include the thymus, the spleen, lymph nodes, and mucosa-associated lymphatic tissues or MUT. These organs are very important for immune defense and help to protect our body from the infection. Lymphatic vessels are found almost everywhere in the body. However, they are absent in certain areas such as the eyeball, the epidermis of the skin, the inner ear, the central nervous system, as well as cartilage and bone. There are two main types of lymphatic vessels, which are superficial lymphatic vessels that run alongside veins and deep lymphatic vessels that follow both arteries and veins. When tissue fluids enter the lymphatic vessels, it becomes lymph. As lymph travels through the system, it passes through lymph nodes where harmful substances such as bacteria and viruses are filtered and removed. After filtration, lymph is returned to the bloodstream through two main ducts, which are the right lymphatic duct and the thoracic duct. In conclusion, the lymphatic system plays a crucial role in keeping our body healthy by draining excess fluid, absorbing nutrients, and defending against disease. It works continuously as a silent guardian within our body. Next, I would like to pass this video to Anis for the next subtopic.
Thank you, Alia. My name is Anis Gelsia Gaylor-Ginda and I am a Year 1 Forensic Science student. So before we continue talking about lymphatic vessels, let's talk about lymph. What exactly is lymph? Well, lymph is mostly water, around 95% water, 4% solid, and the remaining 1% are blood cells, mostly lymphocytes. Now that we have cleared that up, let's continue on about lymphatic vessels. So there are two main types of lymphatic vessels, namely the efferent vessel and the efferent vessel. The efferent vessel functions to carry lymph into the lymph nodes, whereas the efferent vessel functions to carry lymph out of the lymph node. And each of these vessels have a valve, which serves to prevent the backflow of lymph. Now that we understand about lymph and its vessels, we can talk about lymphatic circulation. Lymphatic circulation actually starts in blood vessels, where plasma diffuses out of the blood vessels into the surrounding interstitial tissues, becoming interstitial fluids. This interstitial fluid will then enter the lymph vessel, becoming lymph. Lymph will flow through the body from the capillaries to the vessels to the trunk and duct until it finally returns to the blood vessel. And unlike the cardiovascular system, the lymphatic system does not have a central pump. So how does the lymph move? Well, when we move, when our skeletal muscles contract or when we breathe, this movement is what helps carry lymph throughout our body. So what happens when we get sick? Well, this won't happen all the time, but especially during inflammation or infection, we might have lymphadenopathy. Lymphadenopathy is when our lymph nodes enlarge or swell because our lymph nodes are working overtime to produce lymphocytes to fight the infection. So now we understand the lymphatic circulation. We talked about the vessels involved and the fluid involved, and we even understand about lymphadenopathy. So that is all from me. I will be passing this to Tracy.
Thank you, Anis. Hi everyone, my name is Tracy and I am from Forensic Science. And today I'll be talking about lymph nodes. So, what are lymph nodes? Lymph nodes are small, oval or bean-shaped structures in our body and they usually come in groups, not alone. Their size can vary a lot from as tiny as pinhead to about almond size. You can always find them along lymphatic vessels doing their job quietly. Now, let's move on to the structure of a lymph node. Each lymph node is covered by a fibrous capsule that protects it. Inside, there are trabeculae which divide the lymph node into sections. Lymph enters through the afferent lymphatic vessels and leaves through the efferent lymphatic vessel. The area where the efferent vessel exits is called the hilum. Blood vessels and nerves also pass through here. Inside the lymph node, we have different regions. The cortex is the outer layer and mainly contains B lymphocytes. Just beneath it is the paracortex, which is rich in T lymphocytes. At the center is the medulla, which helps in filtering lymph. Next, let's talk about the circulation of lymphocytes. Lymphocytes enter the lymph node through the blood or afferent vessels, move around inside to check for antigens, and then exit through the efferent vessel. This helps the immune system respond quickly when needed. Now, some common lymph nodes you might have heard of include the cervical lymph nodes in the neck, the axillary lymph node in the armpit, and inguinal lymph nodes in the groin. Finally, the functions of lymph nodes. Lymph node acts as a filter, trapping and removing harmful substances through phagocytosis. They are also important for the proliferation of lymphocytes, where activated T and B lymphocytes multiply to fight infection. That's all for my part. Now, I will pass the video to Yang Tengsi, who will be talking about spleen.
My name is Yang Tengsi today. Let's talk about the spleen, an important but often overlooked organ in the lymphatic system. It sits on the left side of your abdomen, is purplish in color, and weighs about 200 grams. It plays big roles in keeping us healthy, especially for immunity and blood. Looking at its structure, the spleen is covered by a tough capsule. Inside, there's splenic pulp split into two parts, white pulp and red pulp. The white pulp has lots of immune cells, B and T lymphocytes that fight infections. The red pulp is full of red blood cells, plus special structures that clean out old or damaged blood cells. One thing to note, the spleen only has vessels that carry lymph out, not in. What does the spleen do? First, it's an immune hub. It has cells that spot germs, activate immune cells, and make antibodies to fight infections. It also filters bad stuff from the blood. Second, it manages blood removing old red blood cells and platelets. When we're fetuses, it even makes new red blood cells. Interesting fact, we can live without a spleen. If it's damaged or sick, doctors might remove it. That's called splenectomy. The liver and bone marrow will take over its jobs, but people without a spleen get sick. More eyes on this. The spleen's immune role is really important. To sum up, the spleen is more than just a filter. It connects the lymphatic and circulatory systems, protecting us through immunity and keeping our blood healthy. Understanding it helps us see how our body's defense and blood systems work together. Thank you for your attention. Next, I will pass to Alyssa.
Hello, I'm going to explain about thymus gland. So what is thymus gland? So thymus gland is a primary lymphoid organ which part of the lymphatic system. So the location of thymus is located in the upper part of the mediastinum. It lies behind the sternum just above the heart and may extend slightly into the root of the neck. So if you look at the pictures that you can find that thymus is above the heart and it's between the lung. So mediastinum is a space in the chest that holds hearts and other important structures. So change with age. So at birth, our thymus is actually relatively small but highly active. It reaches its maximum size during puberty and the weight is between 10 to 15 grams. But after puberty, our thymus gland is actually undergoes atrophy where functional tissue is replaced by the fatty tissue. So at that time, the weight becomes 30 to 40 grams. And if you look at the picture, you can see that our thymus gland when we are child is big, but when we enter adult, it becomes small due to atrophy. So atrophy is actually the reduction of size and weight of the thymus gland. So functions, we have three functions here. The first one is maturation of T lymphocytes. So the immature T cells mature and differentiate into functional immune cells. Second, forms blood-thymus barrier, a specialized structure that protects developing T cells in the thymus by regulating the exchange of substance between the bloodstream and the thymus, preventing exposure to circulating antigens. Third, produce thymic hormone production, known as thymosin. So thymosin helps to regulate stimulate immune cell development. Okay, structure of the thymus. Thymus consists of two lobes joined by connective or areolar tissue. It is surrounded by a fibrous capsule which extends inward to divide the gland into incomplete lobules. Each lobule has two regions. The first one is cortex and the second one is medulla. And if you look at the picture, we can see that up here is blood vessel, and it kind of like above is a capsule. Then we have trabecule, and then the darkest shade of blue is cortex, and the lightest blue is actually medulla. So what is cortex? So cortex is the outer region of each thymic lobule. It appears darker under microscope due to high density of lymphocytes. It has extensive population of T lymphoblasts, which is thymocytes, and macrophage in a stromal of epithelial reticular cells, which help to support develop T cells and remove defective cells. So due to high number of lymphocytes, the cortex stain the basophilic. So basophilic staining refers to the ability of certain cellular structures to be stained by basic dye. So medulla. So medulla is the inner region of each thymic lobule. It appears lighter in microscope due to low density of lymphocytes. It comprises of epithelial reticular tissue, less dense of T lymphocytes and thymic, or we call it Hassel's corpuscle. So Hassel's corpuscles is formed from epithelial reticular cells. It consists of keratin and sometimes calcified, which is hardened. If you look here at the picture, we notice the epithelial cells, and kind of like a circle around here is the Hassel's corpuscle. Okay, so one of the diseases in thymus glands is actually Discharge syndrome. So Discharge syndrome associates with thymic abnormality. It a congenital condition, meaning the disease is at birth, and it due to one copy of chromosome 22 is missing, which is known as 22q11.2. It occurs as random events in father's sperm, mother's egg, or early when the baby is developed. So symptom of Discharge is, you can remember it by CATCH. C for cardiac defects, A for abnormal facial features, D for thymic hypoplasia, C for cleft palate, H for hypocalcemia. And you can look at both pictures. That the first picture you can see it around his mouth, and the second picture is you can see overall, and mostly it's the way his mouth and eyes look. Okay, and that's all. Thank you.
I'm going to pass the video to Noreen.
Assalamualaikum and very good day. My name is Nuri Humaira binti Abdul Rahim from Medical Radiation course. For my part, I want to present about mucosal-associated lymphoid tissue, or can be called as MALT. Mucosal-associated lymphoid tissue, or MALT, is a type of lymphoid tissue that forms part of the immune system. MALT is present along mucosal surfaces such as digestive tract, respiratory tract, and genitourinary tract, as these sites are frequently exposed to pathogens. Mucosal connective tissue of those tracts contain large and diffuse collection of dendrite cells, lymphocytes, antigen-presenting cells, and lymphoid nodules to protect the body from pathogens.
As I explained in the previous slide, MALT can be found in parts of the body where pathogens are most likely to enter, such as gastrointestinal tract, respiratory tract, genitourinary tract, and all of the body that can be exposed to external environment. Its main groups include Peyer's patches in the small intestine and tonsils in the mouth and throat, which protect the body by detecting and responding to pathogens entering through mucosal routes. MALT has its own characteristic to enable it to protect mucosal surfaces effectively. Firstly, it is not enclosed in a capsule to allow rapid immune response. Next, MALT contains B and T lymphocyte, and lastly, MALT has no afferent lymph vessel, as MALT receives antigens directly across epithelium, so afferent vessels are unnecessary. The last part is on functions of MALT. MALT functions for early detection of invaders such as bacteria, viruses, and antigens that enter through mucosal surfaces. It is also functions to initiate local immune response, especially production of antibodies which protect the mucosal surfaces. That is all from me. I'll pass the video to Fatin Najwa. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. Hi everyone, my name is Siti Nurfati Najwa binti Muhammad Sofakri, a Year 1 Nursing Degree student. Today, I will be explaining about tonsils, which are part of the lymphatic system. Tonsils are defined as aggregates of lymphoid tissue and lymphoid nodules that guard the entrance to the nasopharynx and oropharynx. They are strategically located at the opening of the respiratory and digestive pathways to help protect the body from harmful microorganisms. Next is function. The main function of tonsil is to assist in converting antigens that enter the body through the nose and mouth. They act as a first line of defense by trapping bacteria and viruses before they can spread deeper into the body. Now, we move to the type of tonsils. There are 4 types of tonsils, which is pharyngeal tonsil, tuber tonsils, palatine tonsils, and lingual tonsils. Pharyngeal tonsil, which is located at the roof of the nasopharynx, while tuber tonsils found near the opening of the auditory tube, and palatine tonsils located on each side of the oropharynx, and lingual tonsils found at the base of the tongue. Each type plays a role in immune protection. The palatine, pharyngeal, and lingual tonsils are incompletely encapsulated. Together with the tuber tonsils, they form an interrupted ring of lymphoid tissue known as Walde's ring. This ring provides immune defense around the upper respiratory tract. Now we move to the tonsillitis. Tonsillitis is defined as inflammation of the tonsils. It is the most common tonsillar disease and is commonly associated with sore throat, fever, and difficulty in swallowing. On examination, the tonsil may appear normal or enlarged, and exudate may sometimes be seen, although it is not always present. In conclusion, tonsils are an important part of the lymphatic system as they help protect the body from infection by trapping pathogens entering through the nose and mouth. Thank you, that's all for me.